Good morning. I am Mrs. Deepika Sri from Allied Health Sciences. Today we are going to see the pathologic topic like heart failure, a chronic condition in which the heart does not pump the blood properly or adequately. Heart failure can occur if the heart cannot pump or fill, like it can't fulfill the diastolic or systolic adequately. There are the types of heart failure: left side heart failure, right side heart failure, systolic heart failure, and heart failure with preserved ejection fraction. In left side heart failure, fluid may back up in the lung, causing shortness of breath. Right side heart failure, fluid may back up into the abdomen, leg, and feet, causing swelling. Systolic heart failure, the left ventricle cannot contract vigorously, indicate the pumping problem. Heart failure with preserved ejection fraction, the left ventricular can't relax or fully fill, indicating a filling problem. And then etiology: coronary artery disease, hypertension, damage to the heart muscles, myocarditis, congenital heart defect, arrhythmias, diabetic, HIV, and thyroid disorders. Pathophysiology: due to any cause, the obesity or type 2 diabetes, epicardial adipose tissue expansion, which leads to cardiac inflammation, fibrosis, and microvascular malfunction, which leads to atrial myopathy, which leads to atrial fibrillation, or excessive intolerance, which leads to systemic thromboembolism. And another case, the cardiac inflammations or fibrosis, which leads to ventricular myopathy, which leads to excessive intolerance, or which leads to heart failure with preserved ejection fractions. And then risk factors: alcoholism, sleep apnea, smoking or tobacco using, obesity, virus, congenital heart disease, diabetes. These are the risk factors for heart failure. And then complication: nephrotic damage or failure, heart valve disease, and liver damage. And then diagnosis: in diagnosis, history collection and physical examination. Another one is lab diagnosis. In lab diagnosis, we have to see the NT pro B type natriuretic peptide, BNP blood test, and then medical imaging, cardiac catheterization. The cardiac catheterization is also called cardiac cath or coronary angiogram, is an invasive imaging procedure to evaluate cardiac functions. And then chest X-ray to rule out the whether the cardiomyopathy is present or not. And then echocardiogram and magnetic resonance imaging, MRI. And the specific tests are stress test. The excessive stress test helps determine how heart responds during time when its work is hardest. It typically involves walking on the treadmill or pedaling on the stationary bike while hooked up to an ECG to monitor cardiac activities. And multigated acquisition scan, MUGA scan. A multigated acquisition scan is an imaging test. It measures the percentage called ejection fraction. And prevention of the heart failure: controlling conditions such as hypertension and diabetic mellitus, regular physical activity, healthy diet, maintaining the healthy weight, reducing and managing stress. And then treatment: there are stages of treatment like stage A, stage B, stage C, and final stage D. In stage A, we can treat the patients with symptomatically and medical management like angiotensin converting enzyme inhibitors and angiotensin 2 receptor blockers. The conservative management for the stage A heart failure: low sodium diet, active lifestyle, stopping the usage of the tobacco products. And then move on to the stage B. In stage B is considered pre-heart failure. Most people with stage B heart failure have an echocardiogram that shows an ejection fractions of the 40% or less. In stage B, medical managements are ACE1 inhibitors or ACE angiotensin 2 receptor blockers and beta blockers, aldosterone antagonist, and possible surgery or intervention as the treatment for coronary artery blockage, heart attack, valve disease, valve repair or replacement, or congenital diseases. And then move on to the stage C. There are many possible symptoms of heart failure. The most common are shortness of breath, feeling tired, less able to exercise, swollen feet, ankle, lower leg and abdomen. The medical management for the stage C is beta blockers, aldosterone antagonist, hydralazine, nitrates, diuretics, cardiac synchronized therapy, biventricular pacemaker, implanted cardiac defibrillation, ICD therapy. This biventricular pacemaker and ICD of the minor procedures. And then we are move on to the last stage, that means stage D heart failure. In stage D, heart failure have advanced symptoms, and this is final stage of heart failure. This is usually planned for people who have heart failure. Stage D include treatment listed in stages A, B, C. In addition, it includes evaluation for more advanced treatment options like include heart transplant, ventricular assist device, heart failure, continuous infusion or continuous infusion of intravenous inotropic drugs, palliative or hospice care, research therapies, and surgical management. For stage D, coronary bypass surgery, implanted cardioverter defibrillators, cardiac resynchronized therapy, heart valve repair or replacement like annuloplasty or valvuloplasty, ventricular assist device, and heart transplant. Thank you.